figure, and I agree with them, because the data is old. The data is maybe 5 years, 6 years, 7 years. So we need to find out the correct data. And I am ready, willing, Mr. Speaker. I have set up a committee led by the Director of Medical Services, Dr. Amoth, to make sure that we get the right data. How many of our mothers die? We want to make it a mandatory that every health facility reports maternal and child deaths in our country. That is the questions for Honorable Senator Mutinda, Your Excellency. Thank you.
Senator Mutinda, do you have any supplementary questions?
Mr. Speaker. Bwana Waziri, thank you for your responses. And I want to agree with you that there is no single mother who becomes pregnant and wishes to die or even lose their child. I'm happy that you also note that. Now, I sit in the Committee of Health, and yes, Mr. Speaker, through you, we've really been visiting different counties, and recently we were actually in the Eastern region, and I want to agree that yes, when we ask the question of if SHA is working, the response is that SHA is working. I want to narrow my follow-up questions, Bwana Waziri, to part C. When I asked about the issue of the funds, your response specifies and says that Chief Act 2023, Section 27, has taken care of that. But when I look at Section 27, Bwana Waziri, it is much more on the contribution of Chief. I would want to know, Bwana Waziri, of the measures that have been put in place, that there is a follow-up from SHA that ensures, you explained that Linda Mama is not in place, but it has been substituted. What is SHA doing to ensure that there is a follow-up of these funds specifically for Linda Mama? At the same time, the issues of capacity building, Mr. Speaker. Waziri, you've talked about digitalization and transparency. I have noticed, yes, your team is on the ground doing the digital registration, especially to these young teenagers under 18 who have no national ID, putting in place to ensure that even the young mothers who are not aware that they can actually get these services, they can know that these services are, that there is that capacity.
Yes, Senator Mutinda, avoid speeches. Go straight to the question, please.
Okay, Mr. Speaker. I know the young mothers we've met in hospitals, they have no even phone, they have no documentation. What has been put in place to ensure that even those ones with nothing are being assisted with the shortest time, because sometimes they always explain to us that they have just been kept in hospital, just waiting, to hope that things will be sorted within the shortest time possible. Lastly, Mr. Speaker, is mechanisms to monitor transparency and accountability of SHA funds from Linda Mama when they are remitted to the health facilities, and how SHA is looking forward to sort the challenge that is being experienced by most of the health facilities, whereby there's delayed reimbursement of the SHA fund to the health facilities. Hence, they are not able to continuously sustain offering the best services that they're supposed to offer.
Honorable
Thank you, Mr.
CS,
Speaker.
you may proceed to respond.
Honorable Speaker and the members, the current Linda Jamii budget is 900 million. And this budget is supposed to cover 400,000 teenage mothers across our 47 counties. And every year, the estimates, different counties, the estimate is about, we have in our country about 400,000 teenage mothers. And they are the ones who are to be covered by this budget. So far, from our record at SHA, through digitization, we have covered 22,000, paid for and went home. The question is, how do we trace them? How do we get them? We have the numbers. We have counties with the highest numbers I can give. We have counties with the lowest numbers. County like Kakamega, Kilifi are the highest numbers. What are we doing to make sure we mobilize? We are talking to governors, we are talking to leaders, both political, church leaders, and we are mobilizing a very robust registration of teenage mothers and going with all our county governments. Everywhere we go, we give them the numbers, and we tell them, these are the numbers of teenage mothers who exist in this county. These are the numbers who have visited health facilities and who have accessed this free service. Please help us mobilize. We are using our community health promoters, and we are even urging the House and the leaders to make sure that all of us together, we are not promoting it, but we have no choice. They are our children, and we must protect them. So, including the leadership here, we really want to make sure that we increase our number from the 22,000 teenage mothers who have already accessed and cover all the 400. To date, Honorable Speaker and members, we have 476,553 deliveries, normal deliveries. And we have another 150,602 who went through cesarean delivery. Our community health promoters are well-trained, particularly in terms of registration of teenage mothers. And so far, they claim that SHA has paid, particularly on maternity, is about 9.7 billion to all health facilities at all levels in all the three categories of private, public, and faith-based. So if you look at what this House has passed, the Facility Improvement Fund Act, which ring-fenced funds at the facility for the improvement of those services. And these funds, to the good wisdom of this House, you have decided that the reimbursements must go direct to the facility, not to the county treasury fund, so that the facility can buy drugs, the facility can even hire healthcare workers, either on contract or locum. And all this is geared to make sure that the health facilities are managed better through the reimbursed funds in order for us to achieve key health indicators and priorities, Mr. Speaker. Thank you, sir.
Senator Mandagu.
Thank you very much. My supplementary question to the CS is on the issues of reimbursement and clearance of mothers to leave the facility. Apparently, there is inordinate delay in hospitals, so that the mother can take another 3 days, and the facility says SHA doesn't cover the 3 extra days you've stayed in the facility. And that is what is bringing the trouble of detention of mothers in facilities. I'm specifically speaking of Moi Teaching and Referral Hospital, where cases have been reported to me as the area senator. Apparently also I'm the chair of the senatorial committee, so I cannot escape the response. Since you are here, I think it is a good opportunity to respond to that, so that all other facilities in the country can be able to facilitate matters as soon as they are due for release from facilities. They are immediately released, regardless of the processes that the hospitals have to continue with billing and so forth, so that mothers, again, SHA doesn't pay for them, but they have stayed another 3 days and they are forced to pay, and in the process they actually pay more than SHA, what SHA is paying for them. Thank you very much, Speaker.
Senator Mazayo.
Asante mstahiki Spika. Mstahiki Spika, swali langu kwa waziri wa afya ni kwamba kulikuwa na masikizano ama mkataba hapo awali ya kwamba wagonjwa watakaokuwa wanajiwasilisha katika hospitali za kiwango cha kwanza, cha pili na cha tatu, yaani level 1, level 2 na level 3, hawa wagonjwa hawa ama kina mama wanaokwenda katika zile hospitali ilikuwa watapata matibabu ya bure, ya kwamba wakiingia pale watapewa matibabu na alafu wataenda zao nyumbani bila kulipa chochote, wakati wakiwa wao ni wasajili katika yale mamlaka ya afya ya jamii ambao ni SHA. Sasa nauliza, ni kwa sababu gani bwana waziri, katika ule mkataba ambao ulikuweko baina ya mamlaka ya afya ya jamii ambao ni SHA na vile ambavyo ulipeana mkataba huo, ya kwamba watu wakija, wakina mama, watoto, watu wazima wakienda, ikiwa wao ni members wa ile SHA, wasiweze kulipa, lakini hivi sasa tunaona ya kwamba katika mahospitali yetu wanalipa. Je, iko uwezekano wa kwamba wewe unaweza kuregesha tena hiyo amri na wao wamejisajili na SHA wasiweze kulipa malipo hayo, ili turudi pale pale tulikuwa zamani, ya kwamba wakipata matibabu wanaondoka, watapata matibabu bure alafu waende zao nyumbani? Asante bwana Speaker.
Senator Aaron Cheriot. Now, honorable senators will know that question number 116, which is the next question after this, essentially deals with matters surrounding SHA. So you may want to hold on some questions and ask them when we are dealing with that particular question.
Mr. Speaker, if that is a guidance, then I follow your guidance.
Thank you. Thank you. Senator Shakila.
Thank you, Mr. Speaker. Mr. Speaker, my question is regarding SHA. We know since SHA took over, it has been facing a lot of challenges.
Senator Shakila, I have just said that we will be moving to interrogate matters SHA.
So I'll do that.
You'll get an opportunity at that time.
Okay.
Senator Boni.
Thank you, Mr. Speaker. This issue is a matter of life and death, and the minister has a very good opportunity to speak to Kenyans about this. Minister, a living patient by the name of Sheila Litunya Omungala from Kakamega, Butere, working in Nairobi. She went to deliver. She had paid for SHA. She's a small mamamboga in this town and what have you. She had done her part. But at the end of the process, she was faced with a bill of 51,000, of which thankfully SHA paid around 400,000. The remaining 200,000, they told her, you must pay. Minister, this is the elephant in the room. When a poor woman like that who had played her role, she had paid. She then has to pay 200,000. Then they can't say SHA is working. Because these are the same women, when she was delivering her first and second child under Linda Mama, she just went, delivered, and went back home. But in your case, she's being challenged, despite being a member, you must pay. I want to thank the Senator of Nairobi, because I had to use his office to get to social workers for me to get that bill to be waived. not many patients have access to us leaders.
What is your
So,
question,
Minister, my question.
Senator Boni?
Yeah, I had to pay it because I feel a lot of pain about Litunia.
I share your pain, but go straight to the question, Senator.
So, Minister, the question you must answer for Kenyans. This extra bill, which I expect people to pay, why don't you accept that it is a statement of a failed system of funding, and therefore you rework it so that patients, my dear brother, can enjoy in the same manner they were enjoying under Linda Mama? When you convert Linda Mama into Linda Jamii, that is fraud, because in Jamii, people, and Dr. Moth is there, some of the people in the Jamii have got backache, some weird things. But delivery of mothers is a serious emergency which is life-threatening. You've just told us about the 355 women who die out of 100,000 people. That should not happen. Governor Wamatangi has shown you the way in Kiambu. He has sustained 8 months without a single maternal death. It's doable. And because my younger colleague is there.
Senator Beatrice Akinyi.
Thank you, the Honorable Speaker. Welcome CS Duale to the Senate. And from the onset, I want to say that Linda Mama was one of the best things that happened in this country. My question is, Honorable Speaker, CS, are there health facilities in this republic holding mothers that have delivered for non-payment of bills? And what is the policy of the ministry? Because the ministry is the custodian of the sector's policy. It is sad that there are children who have to spend their first days in hospital because their mothers or their parents or their guardians cannot pay bills. Thank you.
Senator Nabwire.
Thank you, Mr. Speaker, for the opportunity to contribute towards supplementary questions to the CS. One, I would like to ask the CS that anti-D for ESA's negative was a part of the Linda Mama package, but it was scrapped off. So currently, most mothers with this condition are not getting it because of the cost. Secondly, I would like to inform that sometimes patients are not...
Senator Nabwire, you are entitled to just one supplementary question, which you've already asked. Kindly take your seat. Senator Hamida.
Thank you, Mr. Speaker. Bwana Waziri, looking at Linda Mama, unfortunately, free things also at times, they come with a price. We have going to, when we inspect hospitals, we have found shortages of staff, high workload, inadequate equipment, inadequate beds, delivery theaters are not there. And seriously, it's such a pain to see that, imagine, you have a maternity without theaters. So I'm just wondering, is there any awareness? And also looking at our awareness on women, especially the young mothers, that at times the marginalized groups need to know about the right of the Linda Mama and what's covered and how and the access to Linda Mama. One last thing is that the tracking and accountability, Bwana Waziri, how do you monitor for empowerment working? How do we link that monitoring of these programs to outcomes, looking at maternal mortality? Bwana Waziri, I had a motion here in Parliament on postpartum depression, mothers on mental health. And I think my motion went through, and so I think the hospitals need to have a wing for postpartum depression, Bwana Waziri. What we found it very funny is that we've gone to many hospitals, found mothers who have given birth, and they're...
Senator Hamida,
yes.
You have asked
many
questions. Kindly yield. Senator Chirange.
Thank you, Mr. Speaker. Mine is Waziri Duale. Welcome and thank you. You are doing a good job. My question will be very simple, Waziri. This transition from Linda Mama to Linda Jamii, did we at any point lose the package of Linda Mama as you transit to Linda Jamii? Can you give us the package so that you debunk the street political fraud by Senator Kalwale, so that Kenyans, this is the only forum. We don't want Senator Kalwale to go to Malinya and mislead people that shifting from Linda Mama to Linda Jamii is a fraud. You have the opportunity to shine, Waziri. I yield.
Senator Meth.
Thank you very much, Mr. Speaker. Sir. Mine is actually related to what Senator Akinyi asked, and I saw the maternal deaths report, and Nyandarua had the least maternal deaths report in the entire republic. But my question was, Waziri, since most of these facilities that we have are run by county governments, my question is, in terms of detaining mothers and their newborns, is there a policy in the ministry as to how long a mother can be detained in a hospital because they're not able to meet their bill?
Senator Mungatana.
Mr. Speaker, thank you, and thank you, Waziri, for the good job you're doing at the ministry. Mr. Speaker, we pay 2.75% of gross with a minimum of 300 shillings, or means testing is done and we pay 2.75%. Now, this is what Kenyans are paying. The question I wanted to ask you, Mr. Speaker, through the Minister, through Mr. Speaker, is that in this country, we have many other African nationalities who are living here. And maybe part of that report of deaths includes the nationalities who are living in this country from other African nations. I represent this Senate in the Pan-African Parliament. And the question is, are people covered, those who are not paying, like those who are not paying SHA now, are they covered in this Linda Jamii? What do we do with them? How do you take care of the Congolese, the Zambians, the Ethiopians, and everyone who is living here? Your system of registration says *.147#, and if you go down, the next is your ID number. These people don't have ID numbers. What do we do with them? They are with us here. They are still going to give you those maternal deaths. What do we do with them? What is the stand of the Kenya government on this matter? Thank you, Mr. Speaker.
Senator Nyutu.
Thank you, Mr. Speaker, for the opportunity. And allow me to just remind Waziri that the duties under the ministry that he has are very massive, Mr. Speaker, because you can live without an education. You can actually live, you can actually borrow some food from a neighbor, but you can never borrow health from a neighbor. You cannot live without good health. Mr. Speaker, I'm just trying to tell the CS that he would do better to work more than he does politics. That having been said and done, Mr. Speaker, I want to ask the CS, he has in his response about Linda Mama, he has said that they transited from Linda Mama to Linda Jamii. And one of the benefits that according to the response by the CS, one of the benefits then becomes, Honorable Minister, what is the ministry doing to see to it that there is prevention of teenage pregnancies in order for us to do prevention, because we have always been told that it is better than cure? That's my question, Mr. Speaker. Thank you.
Senator Gataya, more fire.
Thank you, Honorable Speaker. My question is very simple. What is the fate of thousands of Kenyans who cannot afford to pay SHA for themselves? Honorable.
Honorable CS, you may now proceed to respond.
Thank you, Mr. Speaker and members. Let me start with the question by Honorable Senator for Uasin and the chair of the Health Committee. Yes, the matter was very unique to MTRH. That issue we have resolved. Those mothers who had, mainly they had no IDs, and but we made our own internal contingency, and SHA has paid, and we have told the CEO and the current leadership at MTRH that that should not happen again. The question to my former colleague and senior Senator Boni Khalwale, and Senator Boni Khalwale, I will not take the advice of the senator for Nandi, because I'm here to answer questions from senators in either form. Senator Boni Khalwale is also a medical doctor. I think the case you have mentioned first must be a very complicated case of delivery for it to reach that level of 600,000. So that was a very complicated case. And SHA covered 60% of the bill. And this must be very clear. Even during the NHIF, there was no full coverage for NHIF. So SHA will cover the bit that is required by law for SHA to pay. There's nowhere where you have to pay 100%. I mean, even myself talking, I have patients. And if the bill is $1 million, SHA pays 700, then the other 300 is an obligation on the part of the family members and relatives of that patient. So, and I think we did our bit. If I go to Linda Mama, first there's no Linda Mama that exists. A transition was done, a more comprehensive, better Linda Mama is now anchored in SHA. And Honorable Speaker, I said it when I was answering the question. And in the answers that I have given to the honorable senators, if you look at it, there's a table. And I'll give you an example. Linda Mama, for level 2 and 3, were paying 2,500. For level 4 and 5 and 6, it was paying 5,000. And in fact, there was no equity. They were paying more for faith-based and private, and less for public. The highest they have paid for cesarean was 17,000. Today, under SHA, it's more expanded, more comprehensive. Any delivery that takes place in our country, if you are registered under SHIF, SHA will pay 10,000 from the 2,500 of Linda Mama. So Linda Jamii is paying 10,000. For cesarean, we have moved from 17,000 to 30,000. That is progressive. And it covers comprehensively. For Linda Mama, it was only, honorable senators, through the speaker, it was only for delivery. But for Linda Jamii, it is everything, surgical, anything that that mother and her child will require, even the treatment of post-delivery. Under Linda Jamii is very comprehensive. I have given the data, and you can look at it. 2, it was budgeted, so the budget was not predictive. We inherited 4.2 billion shillings debt of Linda Mama. Today we will not inherit anything. Today we have no bill. Every mother in our country, and about 1.2 million mothers deliver in our country annually. We can give you those who go through SHA. Since SHA inception in October last year, are close to about 690,000. There are many who are delivering maybe at home. There are many who are delivering in private hospitals and paying for themselves. So my senior Honorable Khalwale, this mother could have had a bill of 500K paid, and I'm sure the balance the family will pay. But I think those are rare cases, are very complicated cases. No more delivery, no more cesarean. You are a doctor. You can do better. Again, with Honorable Mandago, let me just read the package, the SHA package, benefit package, that covers normal delivery at 10,000, and this package includes all that you require: medicine, drugs, procedures. This was not found in Linda Mama. It can only be found in Linda Jamii. So Linda Mama has transited to a more comprehensive healthcare delivery system for our mothers. If a mother exceeds 3 days, as he said, the SHA package reverts to a duly bed rebate, which is found in the law that you have passed. So if a mother stays over 3 days, the hospital is to notify through our system, the SHA leadership and officers, and they will do it. Honorable Senate Minority Leader, I agree with you. We have a serious problem in the implementation of the primary health care fund. Our level 4 sub-counties, Kenya outpatient, Kenyans, all they need to do is to register as SHA members. They don't need to pay, because it is paid by the exchequer. It's paid by money appropriated by Parliament. But we have incidents in few counties, and you have heard many times the President talking about it, where counties ruto. It has never happened. And this is where, and I think this is where Senate would help me, because the Senate oversights counties. Senate oversight counties. The Senate Health Committee should go and do a report and identify. And we are ready to give you. There are 2-3 counties we have found out, and we have told them, and what they are doing is criminal. It's criminal, it's against the law that you have passed. To Honorable Khalwale, I don't know whether it was you. The maternal mortality figures you are giving for Kiambu County is not correct. Yes, it's wrong, and I think it's good you withdraw it. And I am ready to provide. There are many mothers who died, particularly when doctors were on strike. I have the names of the patients, of the mothers, and I have the names of the newborns. I think for record purpose, before the strike, they were doing well. I agree with you. Kiambu was doing well. But as a Minister for Health, I want to confirm to the nation that I agree with the union, with the doctors, that a number of maternal deaths occurred. And I'm ready to provide that evidence. So please, I don't want Governor Wamatangi to hear that and then says I heard it from the Senate. That information is not factual. Senator Nambwere, I think for the first time, the anti-D is an injection. I think the doctors, like Dr. Khalwale, can explain. Is now for the first time is covered under SHA. This is one that helps in the spilling of blood. So this is a more comprehensive now, which is found in the Linda Jamii than the Linda Mama, and the reimbursement for that injection alone by SHA is 6,000. The senator for Nyandarua, Your Excellency, I think he has left. And it's not good, Your Speaker, that you ask a question and then you are not around. When I was, it's not, because you know what was the purpose of asking. But because I'm going on record and the senators are listening to me and the Speaker, let me answer. I think it's good to listen. Anyway, I've done it. It's okay. that his question was policy. And I want to tell him that policy does not allow definition of any patients, including mothers and newborns, in all our health facilities. And we really want him to report to us any such facilities for appropriate. We want the leaders to report to us. And we have a package. Tariffs are better by 3 times the tariffs provided and benefits provided by President Ruto's government. Is far much better than the one of the old government. And why do I say so? I mean, from 2,500 to 10,000 for normal delivery, 17,000 to 30,000 for cesarean section. That alone tells you, in terms of investment alone, is a big difference. And it's a very comprehensive complementary package. And it does not wait for a budget to be allocated. It is not a victim of supplementary reallocations. It is there. Secondly, the 400,000 teenage mothers in our country are fully covered. They just need to walk to any health center with their birth certificate or with their parents' ID, special ID, a temporary ID for all our teenage mothers. We don't want to encourage that. The Linda Jamii covers the whole family. It doesn't cover only the mother. Linda Mama was covering only the mother. This one is covering the child, even after they leave, so this is a more comprehensive. Linda Jamii now covers, Linda Jamii, Mr. Speaker, covers 28,000 per day. This was not present under Linda Mama. And I really want members to get to the package. Linda Jamii now covers anti-D, as the Honorable Senator Nabwere have asked. Linda Mama never used to cover that. I can talk the whole day if you ask me to compare Linda Mama and Linda Jamii. It's world apart. It's like first world, third world, and first world. So I think we must thank prevention of teenage mothers, advocacy. We must do a lot of advocacy. A lot of advocacy with our community leaders, with our church leaders. I think it's a responsibility for all of us. We should not promote it, but we have no choice. They are our children, but we must see how we can reduce it. We must ensure our girls enroll in schools and they stay in schools. That is one way we can. We must make sure that school health programs to teach girls and boys about changes of their premarital sex is part of our curriculum. We must have peer-to-peer support for all adolescents. Honorable Speaker, I don't know whether I have left. There was a question by the Senator for Muranga, and Mr. Speaker, I have read the law. I'm coming to the Honorable Senator for Tharaka. Cabinet secretaries by law, we are politicians and we will politic. And I want him to read the Conflict of Interest. I want him to read the Conflict of Interest Act, which was passed, which amended the Leadership Act. Anybody else in the public service cannot do politics. But CSS, the law allows me, and I've tweeted it, and Honorable for Muranga, you have to live with me. I serve a political government, and the law allows me. If you change the law and says ministers should not politic, I will not politic. But for today and going forward, I abide by the law. I'm going to do politics. You know, I agree. He says...
Order, honorable senators. You've already responded to that,
yes.
honorable
The
senator.
last one is on the senator for Tharaka Nithi, the great county where our very able and intelligent deputy president do comparison. I have a lot of respect for the former deputy president, but I'm just talking about the current Deputy President, Senator. Those Kenyans who cannot pay is a very good question. Before NHIF was a club, the former NHIF, only 1.8 Kenyans in the informal sector have registered. Today I want to report in barely 1 year, because we are about to celebrate 1 year of SHA, over close to 1 million Kenyans in the informal sector have registered SHA. How do they do? There are those who can, they go through the mean testing and they get the amount and they pay. And there are those who can pay. That's why we introduced SHA Lipa Pole Pole. And I want to tell the House, since we introduced SHA Lipa Pole Pole, we have collected over 650 million shillings, where Kenyans go through that. They pay 4 months, the other 8 months, they pay through SHA Lipa Pole Pole, either daily, weekly, monthly. And Kenyans have embraced. As of last night, the figures we got, over 2,000 Kenyans went through the mean testing and paid and through the SHA Lipa Pole Pole. So it's growing. The budget itself and the senators and the speaker are paying more so that the lady in the market, the boda, the people at the lower level of the society can pay less. They can pay 500, they can pay 600 per month, totaling about. There are even those who pay up to 3,600 annually. So, Mr. Speaker, I think I have answered all the questions. Yeah, foreigners, I agree with you. Number one, foreigners have alien cards. Foreigners have different immigration documents. They can use those documents to pay for SHA. The United Nations High Commission for Refugees have signed an MOU with the SHA, and they have brought their people on board, all the refugees, to join SHA. So alien cards are allowed. They can go walk in and pay cash. They don't need to go through the system. And they can use any of the documents, because they must be using a document to stay in our country. They cannot just be in our country without a document. So the document that they will use can be valid for SHA registration. But the one you have seen, Honorable, my neighbor, Senator of Tana River, is the one that is only meant for the people of Kenya.
Honorable Senators, we shall now move to question number 117 by the Senator for Kisumu County, Senator Professor Tom Ojenda. And Senator Beatrice Akinyi is going to ask that question on behalf of Senator Ojenda. You may proceed, Honorable Senator.
Thank you, Honorable Speaker, once more for granting me the opportunity to ask on behalf of Senator Ojenda, the Senator for Kisumu County, to ask the Cabinet Secretary for Health, one, has the ministry established the exact amount of money lost to fraudulent claims under the Taifa Care Healthcare scheme from the recently concluded forensic review and digital audit by the Ministry of Health? And if so, could the Cabinet Secretary disclose the amount and outline the steps being taken to recover the lost funds? The last question, what steps has the government taken to strengthen financial oversight over the Social Health Authority, SHA, and its associated funds, particularly in respect of procurement and overall financial management? Thank you, Honorable Speaker.
Honorable CS, you may now respond.
Honorable Speaker, a very comprehensive, question one, a very comprehensive forensic review and digital audit was commissioned by the ministry, particularly when I came for the month of, I think, June, July, and August. And this review was executed by the Social Health Authority, the Digital Health Agency that is a custodian of the Digital Superhighway, and the Kenya Medical Practitioners and Dentists Council, together with their colleagues, the Clinical Council, who are the regulators. This review has leveraged on SHA upgraded digital infrastructure, working together with the DHA to identify irregular claims, payments, and anomalies which were previously undetected within the legacy of the NHIF system. The first one is on financial exposure. Honorable Speaker, the SHA system digital audit that led to the immediate and successful rejection of 10.6 billion in claims that were non-compliant and fraudulent, and preliminary estimates of this financial exposure related to these irregular payments are in the range of several hundred million shillings. A final verified figure will be communicated once the joint audit of the whole SHA system from October last year, when SHA started, up to October this year is complete. This ongoing forensic validation is a proof of the effectiveness of the Social Health Authority new digital architecture in uncovering and preventing fraud. And Mr. Speaker and honorable members, medical fraud globally is about 30%. What are the preventive reforms under SHA that we have introduced? And so far we have rolled out very robust reforms in order to strengthen governance, in order to put in place transparency and accountability. And how are we doing this? First, we have strengthened our AI-powered digital oversight. Our DHA, Digital Health Agency, has upgraded the next generation artificial intelligence and machine learning tools within the SHA claims adjudication platform. This system, Mr. Speaker, detects abnormal claim patterns. It detects inflated bills. It detects duplicate submission in real time. And this is what we call automated pattern recognition. Secondly, we have digital identity verification. The system links each claim to a biometrically verified beneficiaries, ensuring that only legitimate patients and providers are reimbursed, hence safeguarding the public money. Honorable Speaker, if this House is taken through, and I really want you maybe a time to call one of the time when you have a retreat to invite us, and we tell you, and I'll give you a good example. Honorable Speaker, when a child is born, when a delivery takes place in a health center, one of the critical documents that the Social Health Authority will require, apart from the claim form, is called birth notification. It's good, Senator Khalwale listens to me. You know, he's a doctor, and I want him to go and say it at home. Yes. No, the whole of Kakamega County. Honorable Speaker, that document of birth notification is one of the documents that must be provided with a claim for SHA to reimburse that delivery, reimbursement of 10,000 or even for 30,000 for cesarean. When you don't submit a birth notification document, whether a child has been born or not, the question lingers. That claim becomes not payable. For example, again, and I am sure Dr. Khalwale and many doctors in the House will agree with me, if you perform surgery, any procedure, and you want to do a claim, and the claim form is a legal document, and you have not attached theater notes, SHA will not pay you. Because that is not an evidence that even a surgery has taken place within a theater. But more importantly, we have discovered, even against the WHO rules, a facility reporting that all the 300 or 200 deliveries that took place in that health facility were all through C-section. These are the kind of things the system is picking. We have picked where facilities have turned their healthcare workers into patients, where patients have been told, and that's why we stopped the 1 month contribution, where health facilities will go to the market, use their phone to register, telephone numbers of the old ladies and the old men, either near the church, near the mosque, or near the market. What have we done to stop that fraud? Now we have geo-fenced all health facilities. No healthcare worker in our country, a doctor, can use his pre-authorization code outside 500 meters of that health facility. You cannot do pre-authorization from the bedroom. And we want to stop where consultants and healthcare workers want to run health facility from the comfort of their bedrooms using their telephone. You cannot manage cases using telephones, Honorable Speaker. The second and most sanctions we have done, we have initiated a very structured recovery and accountability plan, including the immediate suspension of facilities, immediate suspension of doctors and clinicians who are found to have misused their OTP, and we have submitted 1,000, we have crossed 1,118 and gazetted in accordance with the law. We have submitted 118 files to the DCI, and I am sure, including some of the staff of SHA, a number have been taken to court, and you might be seeing very, very, very big people going to court either this week or next week. We must fight fraud. The elephant in the room in the delivery of universal health coverage are crooks and fraudsters and thieves. And I want this House to help me, even if when I come back, because we must protect public resources and we must not allow people to eat. We must not allow people to become wealthy by stealing money from sick people. That, I think, we must agree, both as leaders of this country, despite our political affiliation. Mr. Speaker, health is everything. And for some of our colleagues who have really helped me, who say they are listening to the ground. In fact, on SHA, they are listening to the ground. Because Nyeri County is number 2 in SHA registration. That means listening to the ground is very important, particularly when it comes to SHA. Yes, for SHA it is working. I don't know for other things. And Mombasa is number 1 in the country. We must thank the leadership of Mombasa County because he is at 71% in terms of registration. Muranga is one of the top counties in terms of, and I want to thank Governor Kenyatta. I think he's focused, he's a very progressive leader, particularly when it comes to health matters. And there are many, many others.
Order, order, order. Order.
Mr. Speaker, I have no mandate to give my views on the senator. My paycheck.
Honorable CS,
yes.
Do not engage the honorable senators directly.
Thank you, Mr. Speaker. I oblige. The second question, Mr. Speaker, was what has the government taken to strengthen the financial oversight over the Social Health Authority? Honorable Chair, Honorable Speaker and members, the government has initiated several comprehensive measures to enhance financial oversight, transparency and accountability within the Social Health Authority and its associated funds passed by this House. The Social Health Insurance Fund, the Primary Health Care Fund, and the Emergency Critical Chronic Illness Fund. How have we secured this? Number 1, we have strengthened the governance structure. Today, I'm happy to report that SHA operates under a fully constituted board with an oversight responsibility for financial management, audit, and risk functions. The Audit and Risk Committee monitors and assesses the fund's financial integrity. We have also enhanced the procurement controls. All procurement process within SHA strictly adhere to the public procurement and asset disposal, and we have also complied with the directive of the President and the government on e-procurement system, not only in SHA, but in the whole of the Ministry of Health. It's being implemented, and this is to enhance transparency, ensure competitive bidding, and to minimize human discretion in tender evaluations. We have also done automation and financial system integration. Honorable Speaker and members, SHA has deployed an integrated financial management system that links budgeting, accounting, and reporting functions. And this is to ensure real-time tracking of fund flows and promoting operational efficiency. Second last, we have very clear fund management framework. Each of the 3 funds under SHA operates under different distinct management frameworks with well-defined allocation criteria, with well-defined reporting mechanism, and with well-defined investment guidelines so that we can prevent the misuse and diversion of funds. Honorable Speaker, finally, we have introduced a very independent audit and monitoring. Routine internal audits are conducted to assess our compliance rate. We and the Office of the Auditor General carries out an annual audit of SHA accounts to promote transparency and accountability in how we utilize this fund. Honorable Speaker, these measures I have said collectively reinforces accountability. They will safeguard public resources, and above all, they will ensure every shilling contributed towards universal health care and appropriated by this House and is paid by the Kenyan citizens is used efficiently, transparently, only for the intended health outcomes. Thank you, Honorable Speaker.
Senator Beatrice Akinyi, do you have any supplementary questions?
Yes, Honorable Speaker, I have. Thank you, CS, and keep going, because the health sector has to work. Aspect of SHA, a proper database of all the health centers and hospitals eligible to SHA must be kept. Now, in your view, Honorable CS, how many health facilities are currently qualified and receiving money from SHA? And would you be willing to share that list with the Senate? 1. 2, Honorable CS, what is the waiting time by the SHA design? And do you think that waiting time, as is in all insurance practices, working for SHA? Thank you.
Senator Cheriot, the Majority Leader.
Mr. Speaker, I want to thank the Minister for finding time and to respond to very important issues. Secondly, I want to appreciate that this is a very intelligent conversation, listening to senators raise issues pertaining to their constituents, particularly on this very topical matter of social health insurance, because it involves the people that give us a mandate to come to this House, Mr. Speaker. And it's very enlightening. Mr. Speaker, you know, sometimes I get very disappointed, and unfortunately, some of those people that I see in this House sometimes shout in funerals and rallies that SHA is not working. When the Minister is before us now, instead of, you know, it is allowed for a village blogger to say those kind of things, but not for a member of parliament, because you have the opportunity to ask the Minister questions like members are doing this morning on issues which the citizens are facing with SHA. I wish some of those colleagues were here this morning. Be that as it may, Mr. Speaker, I want to ask the Minister, particularly on Section 42 of this Act. You know, this Act, Mr. Speaker, is very dear to us as Senate. Mr. Minister, you may not be aware, but we passed the social health laws, all the 4 of them, in the sweltering heats of Turkana. 4 days of extreme work, and therefore we understand this law fairly well, and that's why we continue to demand that it must work for our people the way we envisioned. Mr. Speaker, Section 42 of that law, Parliament demanded that at the end of 3 months, actually the wording is within 3 months at the end of a financial year, Parliament is supposed to receive a report from the Minister on the operations of Social Health Authority. I want the Minister to confirm to the House that in that report that he shall be sending, or perhaps even if possible, Mr. Speaker, he can send a partial report to this House on 3 items that are very important to us as a House. Number 1 is on the spread of county compensation to the health facilities, county by county, so that we are able to know how much in compensation to public health facilities has gone to specific counties, Mr. Speaker. And I explained yesterday on the floor of this House why that is important. And I want that to be sent because I think it was Senator Mogenio who I had him say on the floor yesterday that SHA is not working. So I want to see if there's any compensation that is going to Nyamira County, as well as all the other counties. Why I want this to be published, Mr. Speaker, is so that we are able to know if our citizens are accessing the services that they are being paid for, because those are the people that sent us to this House. And this is something that I have asked the Minister, including in our private conversation. The second thing that must feature in that report, Mr. Minister, is the penalties that you have referred to and said that there are members of staff of SHA that are about to be taken to court because of issues of fraud. If there is something that can bring down this very noble initiative, Mr. Speaker, it is fraud. And therefore, it will be important for Parliament to be appraised on how this system has been able to detect fraud, who are the officers that were involved, including the professionals like the doctors and the nurses and the people that you've said aid and abet this crime, Mr. Speaker, so that we are able to read out a list and know that there is a Dr. XYZ who works in Hospital Z in County Y, and this is what they attempted to do, and for that reason, they've been bad and they've been taken to prison, because that is where they belong. Because, Mr. Speaker, we moved the amendments. When this law came to Parliament, in conclusion, Mr. Speaker, I know I've taken long, but let me just make the final remark about it, Mr. Speaker. When this law came before the House, the penalty that had been prescribed, just like all laws that come from the AG's office, was just 1 million shillings. But we moved actually that fine from 1 million to 20 million Kenya shillings, Mr. Speaker, because it was in the best interest of the people of Kenya that anybody who tries to cheat the system is punished by law, so that we can save and help these facilities. Therefore, on that account, Mr. Speaker, I expect that the Minister will give us a report of all the fraud that has been detected, the people that have been involved, not just the facilities alone, but the personnel as well that are doing this fraud. The last thing, Mr. Speaker, I am concerned on the rate of rejected claims, particularly in the county that I represent in this House. I was at a public event in a place called Kapkatet a few weeks ago, and the citizens raised concern with me and said, Senator, of all the claims that we have filed, almost 50% are being rejected. What is it that SHA expects of us as a health facility to do? Therefore, Minister, you must tell us as a House, including your officers, to offer subsequent or sufficient training, Mr. Speaker, to health facilities so that they don't provide the service and those claims are rejected. Because at the end of the day, particularly for public health institutions, Mr. Speaker, service has already been rendered and we don't want to sink them in debt. I thank you, Mr. Speaker.
Senator Shakil Abdallah.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the ministry. We know since SHA came, there are a lot of challenges, and that is being said, it's working, but my one area which I'm concerned is the lack of clarity on the benefits of the coverage, which is a big confusion to the people at the ground. Because people go to seek services and they are told to pay, sometimes they don't get the services. So I am not sure whether the ministry, I know that they did public participation and things, but did the ministry, or is the ministry in the position to do this clarification to the people at the ground to know what level pays for what, so that this confusion can stop? Because this hullabaloo cry of SHA not working, it's because of lack of clarity to the people, like SHA is paying for what, where. That clarity is not there, and this confusion is really because people go for services and they don't get the services due to this confusion. So please, if the minister can tell us how do they intend to handle this problem, which is really persisting in the ground. Thank you, Mr. Speaker.
Senator Karungo.
Thank you very much, Mr. Speaker. As I ask my question, it's also good for the good CS to note that when we ask questions for the benefit of the House and the public. So whether a senator is here or not here, just like Senator Ojienda is not in the House and he is answering. So when Senator Medu is not in,
and that's why
we are here listening. Okay, thank you. I just wanted to bring that. Thank you. But in a rare support to the CS from me, Mr. Speaker, I would want to tell Senator Kalwale to stop reading Wamatangi Times and instead read the Kiambu People Times. Because for the last 150 days, Kiambu people have suffered because of the strike by the doctors, which took the Ministry of Health and the Council of Governors to assist. And now I can tell you the doctors are back to work. And I told the Senate, I have statements, I have even pushed the Committee on Devolution, and nobody acted on that issue when it comes to matters Kiambu. So I thank the CS and his ministry and the Council of Governors. The Kiambu people now are okay. But I have a question to you, Bwana CS, because you have mentioned it twice now, that you're going to release the data or the statistics on matters Kiambu maternal mortality. I think you should publish that and publish for all the counties, Bwana CS, because I believe with that information, you'll help the Senate to oversight, take our oversight mandate well, Bwana CS. And finally, Mr. Speaker, some counties are not using SHA. They're charging cash because probably SHA is not remitting on time. So they refuse to admit them and they charge cash instead. So I would also urge the CS to publish the SHA absorptions per county vis-a-vis the registration. Because you might have the number one in registration, yet when it comes to absorbing, you're the last. So I think you should also publish that to help the Senate take our oversight mandate. Thank you very much.
Senator Kathuri.
Thank you, Honorable Speaker, for giving this opportunity also to ask a supplementary question. But before I do that, Honorable Speaker, let me really commend the CS and his team. For this time, we are able to understand what is SHA, what is Linda Mama, between Linda Mama and Linda Jamii, Mr. Speaker. For the first time, CS and your team, led by your peers, Dr. Ruga and Mary Mudhoni, and also now the SHA CEO, Masi Mwangangi. Kenyans are able now to know exactly what is happening. And I wish you didn't mention Waziri Duale. You know, the course you need at the university was not mentioned, but the way you're explaining the SHA and the health systems in Kenya, you are doing better that you are putting across Senator Waziri Duale. But Duale, private hospitals and fee-based hospitals. Still, there is a problem because of that billion also amount that they are owned. And they are not able nowadays to treat. Most of them, they are demanding cash. We want to move from cash to universal health coverage. So what is your ministry doing to ensure that you are in good books with the private hospitals and the fee-based hospitals? Because like where I come from, most of the public hospitals are not functional. But most of the citizens, most of the people from Meru County use the fee-based and private hospitals. So there is a challenge because they are not getting the health care that we need to give them. So, Mr. CS, you can give a brief on what is happening and what you're intending to do with those type of hospitals. I thank you.
Senator for Taita Taveta County.
Thank you, Mr. Speaker, for this opportunity to seek for clarification. Firstly, I've heard Senator Cheriot speak about hospitals that have not been refunded their claims. And I thought that before treatment, there is pre-authorization. So maybe it seems that like there is treatment before authorization. So I'd like to know which type of maladies or which situations require that there is pre-authorization and which ones don't require pre-authorization. But that was not my point. I'm just riding on Senator Cheriot's question. But my question is about payment for SHA. If I register for SHA and I pay, and after 4 months I get sick, and I go to a health facility, I'm required to pay upfront for 1 year. Why is it so? And yet I'm up to date. And then you've also talked about lipa pole pole, SHA lipa pole pole. When do I access it? Do I access it immediately? I register so that I go for SHA lipa pole pole so that I pay for the whole year. And if I'm sick after, let's say, 5 months, am I still required to pay for a whole year? I think that is the clarity I would want. And finally, Mr. Speaker, what is the interest rate for this lipa pole pole for SHA? Thank you, Mr. Speaker.
Thank you. Honorable Chute Mohammed.
Thank you very much, Honorable Speaker. Let me first of all take this opportunity to thank the CS for the hard work it's doing. And congratulations, na asante sana, on behalf of the people of Kenya and Marsabit also. The issue of employees, former employees of NHIF. Some employees from Marsabit asked me to ask the CS if they are not going to be absorbed by SHA. The best they can do is go and join other departments in the government. If they join that department, the salary they were earning before and the new place they are going to go to, the difference is huge. Remember, they've borrowed money for their houses before. They've borrowed for their cars. If they go to the smaller salary, they cannot afford to pay those installments. As Minister, what are you going to do to absorb those guys, the employees, former employees of NHIF, under the same employment and salary terms? Thank you.
Senator Mariam.
Thank you, Mr. Speaker, for giving me this opportunity. Mr. Speaker, my question is about the SHA claim, which the majority leader has a detail of it, but let me just frame it differently. Mr. Speaker, the CS explained that they have a digital oversight over their claim that can differentiate between, can dictate the normal and abnormal one. Mr. Speaker, when we went to county visit, almost 23 facilities, most of them they claim of about rejected claim. So why is it that this rejected claim, and if you have this system can detect the normal and abnormal, see, you have to give the counties a leeway that they can do their part so that at least they can get this rejected claim. Thank you.
Senator Mogo. Recha.
Thank you, CS, for explaining clearly the operations of SHA and the system in health sector. My question is, how can the ministry guard against governors that are killing the public side of medical practice, that is the hospitals, public hospitals, because they have theirs in town, so that people go to theirs in town and the government side is dead?
Senator Veronica Ndwati.
Thank you, Honorable Speaker, and thank you, CS, for what you have explained to the House. We reviewed the answer to get the detail of it, and I'm sure you have dealt with maternal and infant mortality rate, especially because we have been alarmed by what we have seen in Kiambu Hospital. We hope that case is on your desk. Going to the SHA, our phones as leaders have become the backstopping of where patients, when they go to hospitals, the frequently asked questions are actually coming to members of parliament and senators, as opposed to those questions going to SHA. What is the ministry doing to ensure that when patients go to hospitals, seek for emergency treatment in hospitals, they are quickly attended to without requirement for them to pay? And how are you ensuring that anybody who is in an emergency wing of a hospital, public hospital right now, and cannot be attended to because the hospital is insisting that they have not been paid the SHA claims, how are you ensuring they are given support and they are attended to so that they don't have to suffer the consequences of those unnecessary conversations on emergency units when patients need to be treated? Is there any support in that communication and supporting the patient to get access to the health services?
Senator Chiranke.
Thank you, Mr. Speaker. I'm disappointed because most of the senators who were saying SHA is not working, like Senator Omogeni, are not here, including Senator Sifuna, but they are quick to yap in FinRolls that it's not working. Mine, Waziri Duale, is a very simple question. One, you want to ensure USC succeeds. What can you tell Kenyans that today SHA is working, and in terms of improvement of personnel that work within the value chain or the chain of universal health care? Waziri, you and me know that there was a presidential directive, and I know the biggest obstacle has been COG on the issue of confirmation of universal health coverage staff that have been on contract. But I'm happy, through your guidance as the CS of Health, the SRC has harmonized their pay slips. What is the status in transiting these UHC staff to permanent and pensionable so that we make SHA works? And Waziri, can you use this forum to tell the naysayers and doomsayers, including Senator of Muranga, that SHA is working? Mr. Speaker, I find it painful that many people out there are quick to say SHA is not working, yet they cannot come and ask the gracious CS. And I want to thank CS Waziri Duale, because he's the only CS that has always appeared religiously before this House. Unlike other CSs, I don't want to mention names, Mr. Speaker, because I will be accused of playing politics. But I know how to play it somewhere outside there, Mr. Speaker, not in funerals, but in birthday parties. I thank you, Mr. Speaker.
Senator Essie Okanyuri.
Thank you, Mr. Speaker. Whatever I wanted to ask was on the issue of UHC staff, which Senator Cherargei has already highlighted.
Senator Boni Khalwale.
Thank you, Mr. Speaker.
Yes.
I have listened in this House to the Minister and also in the media. When he speaks to SHA, he speaks to two cardinal issues: the success of registration and the challenges in the reimbursements. But in health delivery, the real issue is service. Up to now, St. Mary's Hospital is closed. Colleagues here, they want to play to the gallery to say, you want me to say it's working.
Senator Boni.
Yes.
Senator Boni.
Can you contain him?
Address the chair. Senator Fernandi, allow Senator Boni to make his point. Allow the Honorable Senator to make his point.
Thank you, Mr. Speaker. And therefore, when hospitals served by some of my colleagues and owned by some of them are owed 43 billion shillings by SHA, And NHIF is still claiming 33 billion shillings. How do you expect a clear-minded scientist like myself to say it is working? Anyway, Mr. Speaker, I want, with your indulgence, to allow me to ask the Minister, you have a chance to clarify today. What interest does the chairman of SHA have in the so-called metro group of companies, in the so-called Metropolitan Hospital and /stroke Labdan Hospital?
Senator Newton.
Thank you, Mr. Speaker. And while I want to commend the ministry for unearthing the fraud that had been perpetrated, costing SHA about 10.6 billion Kenya shillings. Mr. Speaker, the working or otherwise of SHA, like the majority whip has said, will be out there, Mr. Speaker. It is the confession of people who actually benefit or fail to benefit from a SHA that are supposed to tell the story, and not basically what the minister says here. And so, Mr. Speaker, it's important that through you we ask Senator Cherargei, to at least for once, act as a senator and not like that sycophant who only wants to talk about things that are working. Mr. Speaker.
Order, honorable senators. Are we not? Order, honorable senators. Senator Fernandi, Senator Fernandi. Senator Fernandi, order. Now, Senator for Muranga, Senator Jonyot, I will not allow absurdity. Once you take to the floor, ask your question to the honorable senator. Proceed.
Thank you. I'm guided, Mr. Speaker. I only mentioned his name because he mentioned my name.
Just proceed to ask your question.
Okay, Mr. Speaker, there is an organization in this country, and this goes to the CS, Mr. Speaker. May I be heard in silence, Mr. Speaker?
Senator Newton, your statements are drawing these unnecessary
I'm asking my question as guided by you, Honorable Speaker. That's what I'm doing.
Proceed.
Can I be heard in silence, Mr. Speaker? Proceed. So my question to the CS, Mr. Speaker, is there is an organization in this country, Mr. Speaker, kindly protect me from Senator Cherargei.
Senator Fernandi, what is your point of order?
Mr. Speaker, standing order 101 and 105. Is it in order for the distinguished senator, our manyora Deharan, to accuse me of being a sycophant when I'm doing my legislative and oversight work? Can he either substantiate or withdraw? We are not in a public library somewhere in Kenol. He can go and do his politics there, but not here, Mr. Speaker. I'm a man who has protected my name, Mr. Speaker, and reputation. I cannot be allowed by first-term senators to come and insult me.
Senator Newton.
Thank you, Mr. Speaker. You would think that Senator Cherargei was born a senator and calling others a first-time senator. Yes, I am a first-time senator, Mr. Speaker, and proud to be so. Because Senator Cherargei was also once a one-time senator.
Senator Newton.
My question.
That is not the point.
My question, Mr. Speaker.
Senator Newton, can you?
I'm asking my question. I'm asking my
question.
Order,
honorable senators.
I'm asking my question, Mr. Speaker.
Senator Newton, you
yes,
will
take
take my
Speaker.
instructions. Yes. So be quiet as the chair gives directions. A point of order has just been raised by the Senator Fernandi, that you've gone ahead to call him a sycophant. His point of order is, would you substantiate that statement? If not, then you proceed to withdraw and apologize. And ask your question.
Thank you, Mr. Speaker.
That's a point of order that has been raised. You cannot interject.
Mr. Speaker. Mr. Speaker, even as I follow your advice and guidance, and even orders, Mr. Speaker, Senator Cherargei has also referred to me as our Munyoro adherent. Mr. Speaker, probably, to be very fair, do we have such an outfit here in this Senate? And so, Mr. Speaker, I think let it be eye for eye. An eye for an eye, Mr. Speaker. He has referred to me.
Honorable Nyoto.
Yes, Mr. Speaker.
Honorable Nyoto, we cannot go down that route where absurdity breeds absurdity. I expected you or any other senator to raise on a point of order. The Senator Fernandi having called you that you're a, what was it again, Wamnyoro? Absolutely. The mere fact that no point of order was raised on that particular assertion. The chair cannot then intervene. But your assertion to the fact that the Senator Fernandi is a sycophant has attracted a point of order. Yours did not. In fact, I did not hear you in any way trying to raise a point of order on that assertion by Senator Fernandi. Nevertheless, the two senators, Senator Fernandi and Senator Newt. Senator Fernandi, you will proceed to withdraw that assertion. Thereafter, the Senator for Muranga will proceed to withdraw the assertion calling you a sycophant. And thereafter, you will proceed to ask the minister your question. Senator Fernandi, proceed to withdraw that particular assertion.
Mr. Speaker, the word...
Withdraw that assertion.
Mr. Speaker, as I withdraw and apologize, the word adherent means you support an idea or party. So it is good that the senator has gone on record that this does not support him. So thank you, Mr. Speaker. I withdraw and apologize. Let the people of Muranga watch.
Senator Newt to proceed to withdraw that assertion.
Thank you, Mr. Speaker, and I'll follow the cue from the experienced senator from Nandi and say that a sycophant is only somebody who says things to please somebody else somewhere. With that, I withdraw and apologize, and Mr. Speaker, now proceed to ask my question to the Honorable CS. Mr. Speaker, I was just bringing to the attention of the CS that there is an organization in this country called RUFA, meaning Rural and Urban Private Hospitals Association. And Mr. Speaker, hospitals under that particular association are not offering services to those covered under SHA. And Mr. Speaker, then my question to the Honorable CS is, exactly what plans are there to see to it? Because these hospitals serve very many Kenyans, Mr. Speaker, and without them recognizing SHA, then many Kenyans have a problem. That was my question, Mr. Speaker. Thank you. And thank you for your Solomonic wisdom and your impartiality. Thank you, Mr. Speaker.
Senator Osotsi.
Thank you, Mr. Speaker. Mr. Speaker, I want to ask my good friend CS a question on the status of NHIF reimbursements, which have been outstanding. If there is any breakdown that he can give this House. Because as we talk about SHA, we should also be alive that there has been long outstanding debts owed to these hospitals by the defunct NHIF.
Honorable Chair, Honorable Speaker, let me start with the first question that Honorable Beatrice Ogola. For record purpose, from the Kenya Medical Practitioners and Dentists Council, Honorable Speaker, that registers all our health facilities. The total number of health facilities registered in our country are 14,876, out of which public facilities are 6,005. Two, on the same and the leadership, and the Council of Governors is coming back to us. And COG is working with SHA to ensure that they update their bank accounts, particularly for the primary health care. And two, still Ogola, SHA has a database with a very active number. Now the ones who are registered under SHA, both public, private, and faith-based, are 10,451 facilities, with each one having a provider portal right. And payment for these facilities is dependent on the claim review process. Every claim on our dashboard in our system, even when it is rejected, it will give you the reasons why it's rejected. If you have not submitted required documentation, it tells you submit the following documents within 14 days. And different claims are in different stages. Some have just been submitted, some are under review, some have been approved for payment. So it's like a whole ecosystem, and that's why we call our digital system, we call it the digital super highway. When I come to the question raised by the leader of majority, Senator Aaron Cheriot, I agree with you, we will comply. We will comply with the law, and we will, Honorable Speaker, through you, we will give this House any information that is required within the shortest time possible, and I'm sure the members and the chair and the vice chair of the Health Committee know that whenever I am called, I appear. Just for example, to give you, under the PHC, the primary health care, which is exchequer funded, a very unique thing under this leadership. The problem, people who are opposing SHA are not the patients, are not the health facilities, are people who have a problem with the government of President Ruto. And we have no problem with that. Because today as we speak, Honorable Speaker, over 27 million Kenyans have registered SHA. Mombasa leading, Nyeri number 2, Kirinyaga, Bomet. That's how I can give the list of all the counties. And under PHC, so far, the primary health care, we have given counties 5.6 billion since last October. And we are ready to provide county by county, faith-based facilities who attend to Kenya for this free primary health care. We have given them 745 million. We can give the list one by one. Under SHIF, county governments have so far, depending on how they do their claim, there are some county governments like Mombasa, like Nyeri, like Nakuru. And let me say Nakuru PGH is one of the best model that is implementing the social health insurance fund. Since October, Nakuru PGH and Coast General Hospital have received close to $1 billion shilling because they do manage their claims properly. The faith-based organizations have got about 12 billion. MOH, these are the referrals, Kenyatta University, MTRH, Madare, and all these. They have received 6.5 billion. The private facilities are the largest who have received under SHIF, 29.3 billion. This report is ready. We can provide it to the House anytime we are required. The animal or the elephant in the room is rejected, and I want senators to listen to me, Senator Cheriot being. If you see somebody asking you, there are a lot of rejections, he doesn't want to come and face SHA. In SHA, we have relationship managers at the county level, at our headquarters. Our system gives you reason. We have men and women, doctors who do clinical review, who will tell you why your claim is rejected. But because they know those are fraudulent, those are frauds, And we are coming for them, Senator. Tell them we are coming for them. And why are claims rejected? I want to give you 5 reasons why claims are rejected. And once it is rejected, for the information of this House, we are not paying. Claims are rejected because there's no claim form. The law you passed here, the 4 laws, at the bottom of those laws, you have designed a claim form. So a claim form is a legal document. If a facility has not provided a claim form when they are asking for reimbursement, that becomes automatic rejection. If the facility has not given us itemized invoice, that is a rejection. If there are no discharge summaries, God forbid, let me pick on even Senator Cheriot or Senator Khalwale. You go to Nairobi Hospital, you stay there for 2 days, there's no discharge form. And it's deliberate because they want to claim 30 days when that patient has stayed for only 4 or 5 days. So if you don't give us a discharge summary on when the patient has left, that is a rejected claim. If there are no supporting theater, if a patient, a Kenyan citizen, who is a member of SHA, paid up member of SHA, goes to a theater for any type of procedure, and then you make the claim to the Social Health Authority for reimbursement, and you have not attached theater notes, doctors who are in this house will know that. I am not a doctor, but I read, and I learn from people I work with. If there are no theater notes, that's a rejected claim, and we will not pay. If there are no birth notification, if a delivery has taken place in any of our health facility in our country, the mandatory document is a birth notification. If you want us to pay for your delivery, whether or normal or cesarean, and a birth notification is missing, we will not pay you. We cannot confirm whether a child has been born, whether a delivery has taken place. It's rejected, Honorable Senator, for Kericho. Upcoding. There are people, and this is a medical fraud. There are people, a patient goes for a small boil that takes about 1 hour. The claim they make is that they have done a bigger procedure by even cutting his hand. That is called upcoding, and the system will pick you, we will not pay you. If you convert outpatients into inpatients, that is the biggest fraud. There are Kenyans who go, they are treated, they go home, then the facility turns them into inpatients because they want to claim the bed. They want 5 days. But now, going forward, they cannot do it because now we have introduced the biometric. A Kenyan must go through the biometric when he goes to hospital, and he must go through biometric when he's being discharged. But before the biometrics, they were turning out patients, and we have got evidence of patients who have gone even to the DCI, who are saying, I went for a day. Why is this facility claiming 14 days? Honorable Senate Majority Leader, we will not pay. And please tell these people who tell about rejected, let them go to SHA, they will get all the explanations. As of today, there are people who tell you SHA does not pay. As of today, faith-based, and let me pick, and I want Honorable Khalwale to listen to me. St. Mary has been used for many months for political expediency. It became the talk in funerals and everywhere. I went and sat with the Bishop of St. Mary. I sat with the Bishop of St. Mary, with the whole of my team, including the bank manager. And we have shown our Lordship, the Bishop, that SHA has paid him 90 million shilling. We have given him the TT, the transfer. The balance that at time had was 14 million. We have paid the 14 million. It is you now to go and ask the bishop why he's not opening the facility. And the bishop was with me in a press conference. And I said it. And I said it. Let us not use, St. Mary for politics. And I'm saying it, and I'm sure the people of Kakamega are watching me. Look for something else. St. Mary is a closed chapter. You cannot use St. Mary based. We have the numbers. Before the end of the day, Senator Boni Khalwale, I have sent to you on your WhatsApp more than 5 times. You did not respond to me. I gave it to Prime Cabinet Secretary. When nobody could hear, I flew to Kakamega. And I sat with the bishop. And we did reconciliation. We proved to him that we have paid him 90 million. If today I pay in Nairobi Hospital, for example, and the management decides not to run the hospital and close it, that is not a function of the Minister for Health. But for my brother Boni Khalwala, number 3, our system is real time. Number 4, St. Mary owes us 8.5 million, and St. Mary owes us 8.5 million, and all these were lodged in the month of October. By the 14th of November, our next payment cycle, if these 8.5 are verified, we will pay. But so far we are paid 114. And please help me. I'm sure this weekend you'll be in Kakamega. I want you to have a different story. To say that St. Mary, Shah has explained, St. Mary, the problem is the management, is the leadership, and I am ready to go with you. I am ready. But Shah is working. Shah is working.
Just to finish up the questions.
Mr. Speaker, Shah is working, and I have said, you can have a problem with the President Ruto's administration, but Shah is working. It is unimaginable every day between 25 to 35,000 Kenyans register voluntarily as members of the Shah Social Health Authority. The train has left. We will implement what many people could not implement because of many side issues. Senator Kathuri, my Deputy Speaker now on the chair, I agree with you. The faith-based settlement rate is at 69.
You know, Senator Mboni, why are you interrupting the CS? You know the CS is not even in the side of the House. That is why you cannot raise a point of order. Maybe after he summarizes his question, you can seek clarification. But not a point of order to the CS. You know, please, Boni Khalwale, I told you, let him finish the questions. Actually, he's answering the questions for the U.S. truly. You should be very quiet.
Thank you, Honorable Speaker. Honorable Speaker, your questions, yes. Faith-based hospitals, our settlement rate is 69%. Private hospitals, it's at 56%. Public hospital settlement is at 55%. And this is delayed because of poor documentation. But the matter that you have raised is very critical. And this is a discussion for the Senate and for the Council of Governors. The people who work in our counties, facilities, own private facilities next door. They own facilities, and I've told governors. So they work at the counties as retention, but they really do their business. And I'll give a good example of Kakamega. The number of patients seen in Kakamega public hospitals and the amount of drugs dispensed does not tally, which means the drugs are being taken to private facilities. And that's why I call upon this great house, which is a custodian of devolution, and which has a Senate Devolution Committee and Senate Health Committee, to go out, because health is devolved. There's very little I can do, and make sure, go see and ask what is happening. We have seen facilities we were closing that are owned by people who work in county governments. So we need to deal with that, Honorable Deputy Speaker who's on the chair. Honorable Veronica Maina, yes, the emergency cover is active now in level 5 and level 6. We were doing a pilot phase, but I want to assure this House that the emergency cover will be up and running on December 1st. to cover all emergency centers in all level 4. Our ambulance services within the ECCIF will be launched in December. And this is one of the beauty about universal health coverage. Never again will a Kenya on an emergency go to a hospital and he will be asked for a deposit. The emergency center we are going to establish will send the nearest ambulance to that Kenya who is in distress in terms of health. It will take him to the hospital. The ambulance is paid by SHA at the rate of 4,500 if it is a long distance in every 25 kilometers. And then when he's delivered to a health facility at any level, that Kenyan, the first, he lost to Dr. Boni Khalwale. And he wants to use SHA to again for his political engagement in Kakamega County. So he has a choice to make. He has a choice to make. Speaker, let me say it. If the truth is hurting Senator Boni Khalwale.
Honorable CS, just a minute. You know, I want to protect the Honorable Senator for Kakamega. Stop referring to him directly, just make your comments. But without referring to him, I'll give you a chance to seek clarification. I'll give you later. Let him finish.
Chairman, let me finish.
Let him finish. I'll give
Let me
you
finish.
just
So,
cool down.
because the great senator of Muranga has asked me.
Just cool. I will give you that opportunity to raise your concern.
Mr. Speaker, do I have the floor?
Honorable Nikarwale, Senator
Mr. Speaker, what I am giving this
Senator
out,
Boni.
I am going on record, is fact, and the Honorable Boni Khalwale should hold his horses. Because Rufa, the leader, the chair of Rufa was his competitor in last election. That is a fact. That is a fact. It's not deniable. Number two, Rufa is an organization. SHA has specific contracts with the over 10,000 facilities. So we don't have any contractual obligation. The Rufa with any of the faith-based association, the Council of Governors, all of them engage them as organization. But the people who have contractual obligation, who must follow the law, what they have signed, whether in faith-based, whether in private, whether in public, is individual hospitals in our country, because they treat patients individually. There are no patients which are treated by organizations. So we want to get the accountability must be on the person or the facility that has signed a contract. So Rufa, the issue is they do a lot of press conference, they can continue. They can continue. Because Kenya is a free country. On the issue of the debt of NHIF, I agree. The biggest problem we have, and that is even making SHA, the debt of the 30 billion of NHIF has brought down facilities. Some facilities are getting closed. But Mr. Speaker, when I came to the ministry, I set up a very independent committee to verify. Just like the way Edward Awuko, our former Auditor General, is verifying the pending bill of the national government. And he was given a pending bill of 506 billion. He could only verify what we saw in cabinet. I think it's about 206 billion. Some people disappeared. Some did not bring their documents. The same law that tells me I should pay is the same constitution and the PFM Act that tells me and tells us sitting on this side, and subject to your oversight, public funds. Now what I have done is, the people who are owed by NHIF, between 1 shilling to 10 million is about 5.3 billion. Some of them even are owed 300 shillings. And I can provide the list to this house. Now, I have written to the Minister for National Treasury, and that 5.3 billion accounts for 95% of the total debt of these people who owe NHIF. The rest are big people. So I say, let's first pay the 5.3 after we verify. We have now started verifying. I have written to the National Treasury with the blessings of the President after consultation. And by the time the supplementary comes and we have finished verifying, I want to assure the people of Kenya we will pay the 5.3. Secondly, the rest I have also asked a team led by same Auditor General, because his pending bill committee is still alive, with its auditors from SHA, MOH, to sit down and verify, and we must pay that. Whether it is 10 billion, 15 billion, 20 billion, we must pay, so that our facilities, our people should not lose their investment. There are facilities that are having serious financial challenge. Let me be very honest, because of the old debt. With the SHA, if your bills are verified in this house, they will be absorbed in any of our other public institutions at the same salary and package that they were having at NHIF. I have agreed with the court, and we have said, and I have a letter from public service, a letter from to that effect, and I want to tell our staff, the Kenyans, because I agree with you, they had mortgage, they had many things. If they go, for example, to my ministry, or they go to KNH, they will not earn a new salary. They will earn the salary they were earning at NHIF, and they will be placed at the grade, if not better, than where they were at NHIF. I think, so Senator Nyutu, please tell the roofer, I don't deal with, when it comes to money, facilities, the CEO will deal with people who have. Yes, the question about the chairman of SHA. Yes. The chairman of SHA is called Dr. Abdi. And Dr. Kalwale knows. Dr. Abdi does not own before he became chair. He had a historical ownership. He had a historical ownership of Ladnan. He had an historical ownership. And in fact, it is Metro that bought Ladnan. And you know the owner of Metro. It's one of our most progressive health facility provider. And I think it's not good. Kenya, you know, it's like the people were saying, Aden Duale owns a facility. My assets and liability are within the records of Parliament. I was vetted by Parliament. What I own, if I own a chopper, I own a chopper. If I own camels, I own a camels. And if he owns a facility and you have approved, we will remove him as a chair of SHA. But we will not allow people to smear other Kenyans, because Dr. Abdi is other, to smear other Kenyans, even if it's Dr. Boni or Dr. or Cherargei or Senator Veronica. Because of politics, we will go by the truth. Honorable, my good friend, my leader of the whip, I want to assure you that he does not own. In fact, the Health Committee of the National Assembly visited London, they visited Metro. They confirmed the ownership is not with Dr. Abdi, a committee of this House. I think, Honorable Speaker, I don't know whether I have left. Oh, UHC. Okay. Oh, yes, UHC. Yes. Yes, let me start with Honorable Shakila, the Secretary General of one of the biggest party.
Stop heckling.
Honorable Shakila asked about our benefits. Our benefits are in the regulations that have been passed by these houses. And the clarity is in the regulations. What is lacking, and Honorable Shakila is saying, is sensitization. We have asked hospitals to put posters in every place in the hospital to show this is the package for oncology, and we will do working together with SHA. We want leaders, all of us. We will keep on sensitizing our people. Even last night, if you...
Senator Shakira, why are you shouting from your seat? Why? No, that is not the way we transact business in the Senate.
So we will do. And then the issue of UHC.
We have no time.
The issue of UHC, Mr. Speaker, and I want to thank Senator Cherargei, just like Senator Khalwale, they represent a wide range of constituency. That is, Cherargei, that's his constituency. But these Kenyans, close to 7,000 plus, have suffered for too long. They were employed during the COVID. They did good work. They are still doing good work. Part of what we did for the achievement and the attainment of a complete universal health coverage, healthcare workforce is the most important pillar. And that's why we fixed the interns. That's why we dealt with all the health bargaining agreements. That's why you see doctors. Now, UHC, we have the money as a national government. We have the salary, we have the allowances, we have everything. The president has committed in public that the national government will pay. And we have so far put them under the SRC rates. So they earn very good money now. What is remaining is a transition from contract to permanent and pensionable. And because they work in the counties and they are under the public service boards of our counties, I'm still engaging with the county governments. But I'm a bit frustrated because they don't see how these Kenyans are suffering. But again, I am ready. The chair of health committee is sitting on the house, Honorable Mandago. You have some powers more than me as a custodian of devolution. You need to call us. The money is available, allowance is available, everything. Ask the governors why they are not transiting these good people to permanent and pensionable. If they were, and if they refuse, I can take them. I can take them to our referral hospitals. We have a huge shortage, so that these Kenyans can have that choice. And Chair, I think that is, Lipa Pole Pole has no interest, has no fees, has no levies. It is free. You pay 4 months, the other 8 months, after you go through the mean testing. If the amount is 7,000, you say, do you want to pay the other 8 months daily, weekly, or monthly? Every day, over 2,000 Kenyans go through Lipa Pole Pole. If you don't want to do that, there is nothing we can do. 651 million shillings we have collected since the president announced Lipa Pole Pole in Homa Bay first day of Madaraka. So Lipa Pole Pole is working very much. If you see somebody who doesn't want to do that, then as some senator said here, you can even live with illiteracy, but you cannot live with the sickness. I want to urge Kenyans, universal health care is working. Please let us register en masse for SHA. Let us protect ourselves, our children, and our next of kin. Thank you, Chair.
Thank you. Senator Boni, what is
there was a question from the senator for Kiambu.
Under 1 minute. Just a minute. You will answer with together with
Mr. Speaker. The senator for, let me answer the senator for Kiambu. I agree, and many people agree with me. The maternal and child mortality rate in our country is not very good. It should be a national discussion. I have agreed with the president that we must make it a national discussion. Leaders must make it a national discussion. We have about 20 counties that are doing very badly. And we are going to name them. And we are going to shame them. Secondly, we are putting in our digital superhighway as a system where every facility in our country must report maternal or child death on a daily basis. And they must give the reasons. They must give the reasons. And this is real. Our neighbors are doing better than us, all of us. A mother walks to a hospital, she is not a patient. She is very happy. She wants to come out happy with a baby. She is going to a facility to give us another life. We cannot, as a country, it is immoral, it is unacceptable, it's unconstitutional to have the maternal child mortality rate we have in our country. And I think as our leaders, both in all the three arms of government, our religious leaders, we must do something. Our women must do something. But as a Minister for Health, this will be one of the legacy that I have to leave as the Minister of Health.
So we have like 5 minutes. So Dr. Boni Karore, under 1 minute, seek your clarification.
Mr. Speaker, the reason why I was rising to appeal to the minister that this hubris is the demonstration of arrogance of power. You cannot disrespect.
There is no clarification.
Mr. Speaker, this is the House of Debate. You cannot, Dr. Brian Lishenga, find it okay and be unable to speak about Dr. Abdi unless you are in office to launder some people.
No.
Number two, you cannot transfer the responsibility.
You have no mic, Senator Boni Karware. Minority Linda? Minority Linda? Senator Boni Karware, I will like kick you out of this house the rest of the day.
But you see, this is what's going
on. No, that is not the way we transact business, and you know.
And now he's here, you think you can...
Senator Boni Karware, Senator Boni Karware.
Managing the National Assembly and the Senate? Really?
Senator Boni.
You think I don't know how government works?
Minority Linda, Progress?
Yes, asante naibu wa spika. Nilikuwa nataka kuuliza lile swali ambalo nilikuwa nimeuliza hapo awali ambalo waziri analijua, na huu mswada wa kwamba waziri yuko hapa hivi sasa umezua mwamko mpya.
Senator Mudigi,
kwamba
allow the CS to get the clarification that the minority leader is seeking. Katika
kaunti ya Kilifi hivi sasa kila mtu anafuata hii debate ambayo inaendelea hapa, na ingekuwa vizuri sana ikiwa bwana spika utaniruhusu nimuulize waziri lile swali ambalo nilikuwa nimeuliza hapo awali aweze kulijibu kwa lugha ya Kiswahili. Manake mimi nimeuliza Kiswahili na yeye ni lazima anijibu mimi na lugha ya Kiswahili. Ingekuwa bora zaidi ili watu wangu wapate kuelewa masuala haya ya mamlaka ya afya ya jamii. Sijui kama bwana waziri anaweza kuniruhusu, bwana spika unaweza kuniruhusu niulize swali kwa uharaka. Katika
si amekupata
katika masikilizano yale ambayo alikuwa ameyafanya hapo awali huyu waziri, wagonjwa wakienda hospitali, akina mama na watoto na jamii wakiwa wameenda hospitali ile ya level 1, 2 and 3, kumekuwa na tetesi kwa sababu hivi sasa wao wanachajiwa, na hali mkataba uliowekwa na waziri pale ilikuwa ya kwamba watu wakienda level 1, 2 and 3 wapatiwe matibabu alafu waende nyumbani.
Na dakika moja ndio wacha kujibu.
Asante sana bwana waziri, kama unaweza kunijibu itakuwa vyema zaidi.
Waziri, Kiswahili ni ngumu, lakini nataka nisemwambie Mheshimiwa Khalwale, mimi ninaheshimu sana bunge. I have a lot of letters for parliament and I don't want to go into that. I have no hubris. I have a lot of respectable members of this house. Honorable Chair, Kiswahili ni ngumu, lakini zile vitengo ya mimi ni Mkenya. Mimi si Mswahili, lakini natumia lugha ya Kiswahili. Nitajaribu, lakini isiniletee shida ya kwamba waziri wa afya ameshinda kuongea lugha ya taifa. Ile zahanati ya level 2, level 3 na level 4 zingine ambaye tunaita kwa lugha ya Kimombo primary health care, ambaye inatibu wale wa Kenya wa kukuja na kuondoka, kwa lugha ya Kimombo inaitwa outpatient. Nataka nihakikishe ya kwamba hiyo ni bure na inalipwa na serikali kupitia bajeti ambayo inapita katika bunge la kitaifa. Na mwaka huu ile pesa imewekwa ni bilioni 13. Na hatutakubali, na ni kinyume ya sheria, kama hizo zahanati kama ni ya kibinafsi, zile zinaendeshwa na vikundi vya dini, ama zile zinaendeshwa na serikali zetu za county, kulipisha wa Kenya. Na tukijua wewe unalipisha, basi tutakunyang'anya ile leseni ya bima ya kitaifa ya SHA, kwa sababu SHA ndio inakupatia pesa. Na kiongozi wa wachache katika bunge la Senate, nataka niseme hapa leo ya kwamba ile pesa ushuru ama ile pesa county serikali zetu za ugatuzi wanasanya, ile mnaita kwa lugha ya Kimombo county revenue, on source revenue, kila county pesa nyingi, 65% juu kwa 100 ni kutoka pesa ambayo wanapata kutoka sekta ya afya, na hatuwezi kubali. So Wakenya, nyinyi pia Wakenya wanasikiza, msikubali mkienda dispensary, mkienda health center, mkienda hospitali ya sub county, ile ya kwenda na kurudi nyumbani inaitwa Kimombo outpatient, ni bure. Na msikubali, ile inahitajika uwe umekisajili kuwa mwanachama ya SHA.
Asante waziri, na asanteni kwa kufika Senate. Tunashukuru na muende salama. Asante. Honorable Senators, it is now 1 p.m. time to adjourn the Senate. The Senate therefore stands adjourned until later today, Wednesday, 29th October 2025 at 2:30 p.m.